So cancer-related fatigue is caused obviously by cancer itself, but also caused by the different modalities of treatment that is used to treat that cancer. So for ovarian cancer specifically, the most common treatment approaches are normally surgery and chemotherapy. So and in some cases also radiotherapy. So all of these treatments, they're aiming at killing the cancer cells, and they can be really aggressive and insulting to the body. And therefore they cause an inflammatory process, and the body needs to cope with that by trying to heal itself and trying to cope with all that aggressive treatment. And then it produces, as I said, an inflammatory process, and the body uses then a significant amount of energy to try to compensate for that and try to cope with these changes. So then fatigue can come, as I said, from both cancer and the treatment approaches. Cancer-related fatigue and normal tiredness, they're very different. So we normally say that cancer-related fatigue is significantly more intense than normal tiredness. So the intensity is one factor in which they're very, very different. So individuals who have cancer-related fatigue, they normally feel a complete sense of depletion of energy. So they feel extremely exhausted. Whereas and that might impact on their usual functioning, that might impact on their ability to do everyday activities, for example, have a shower, get dressed, and things like that. So for example, with normal tiredness, we might have spent a whole day out and about on our feet and spending a lot of energy, but we're able to get back home and normally have a shower and maybe cook something for dinner, whereas a person with cancer-related fatigue might not be able to do that because the intensity of fatigue is so much more than normal tiredness. With regard to activities that people have recently done, that is also different from normal tiredness and cancer-related fatigue. So we say that cancer-related fatigue is not proportional to recent activity. So normally we can always establish a kind of a causation between why we're feeling tired. So we might say that, as I said, so I spend the whole day working on my feet and then I get to the end of the day and I'm tired. Whereas a person with cancer might not necessarily be able to attribute why they're feeling tired. It might have been that they just woke up, they had a really good night's sleep, but they're still feeling that they can't really do everyday activities. So cancer-related fatigue is not proportional to recent activities. And also, I would say that in normal tiredness, we use some strategies to restore our energy levels, and they normally work. Whereas with cancer-related fatigue, the normal strategies that we use for relaxation and for energy restorations, they might not necessarily work. So there must be some other strategies throughout the day to be able to, so that a person with cancer-related fatigue can manage their energy levels. It is difficult to answer the question about how long cancer-related fatigue lasts. So it depends on various factors. One of them is the stage at which the disease was diagnosed. The other factor is what treatment approaches have been used. So has that person gone through surgery, chemotherapy, radiotherapy? So all of that will impact on how long and how long they had treatment for as well. That might impact on how long the cancer-related fatigue will last. There's also other factors that might impact on fatigue. So one of them, for example, is how well a person sleeps, or if they're having sleeping problems or sleeping difficulties. Are they experiencing pain, or are they pain-free? Or if they have a lot of anxiety and stress in their lives, that can also impact on cancer-related fatigue. I would say that normally what we observe in clinical practice is that most patients will have a lot of fatigue during treatment, and that fatigue might last for a few weeks or months after treatment has finished. However, we also see that some patients who have finished treatment after months, they still experience cancer-related fatigue, and sometimes even years after treatment has finished, that can also be a problem for patients who have cancer and go through cancer treatment. The three key pieces of advice that I would give to someone experiencing cancer-related fatigue is to try to break activities down as much as possible. So normally we tend to do activities as we used to do before we were diagnosed with cancer, before we had cancer treatment. And that is sometimes hard because our body is struggling and using a lot of energy to cope with treatment and to cope with the disease. The energy restoration is not as straightforward as it used to be. So I would say try to break activities down. Try not to do everything you want at once, because that means that when you use a huge amount of energy, you might not have any energy left for the rest of the day or for the rest of the week even. So I would say break activities down, do one thing at a time, and try not to rush to do activities. So that would be my first piece of advice. And the second one would be to really try to prioritize sleep. So individuals with normal tiredness or people with cancer-related fatigue, both groups, we need sleep for energy restoration, and sleep really needs to be a priority. So we need to look not only at the quantity of sleep, but also at the quality. So are we trying to make sure that that person has a good night's sleep, that they can actually, not be waking up during the night or not wake up and be worried or suffer with insomnia and things like that. So prioritizing sleep is a very key piece of advice that I would also give. And the third one, which might sound a little bit counterintuitive, is engage in physical activity. So normally people who experience fatigue, they feel like they can't really do physical activity just because they don't have the energy to kickstart it. But we normally say that physical activity is very different from exercise. So we're not talking about going out and running 5 kilometers. We're talking about gentle activity that a person can do, because there is some evidence that physical activity can actually improve fatigue levels and give that boost of energy to an individual. So it might be having a 10-minute walk around the block. It might be going swimming, for example, or it might be doing something, for example, as playing on the floor with your children, for example.